Well, that really depends on two things. It depends on the kind of operation that you've had, because not all weight loss operations produce the same amount of weight loss. Some are much more effective than others. And it also depends how heavy you are at the time you have your surgery. The bigger you are, the more stones you will actually lose. So a gastric band patient would typically lose about half of the extra weight they were carrying, and that would take 2 or 3 years for that to occur gradually. A gastric bypass patient, I'd expect to lose about 3/4 of the extra weight. So a bypass patient who was 10 stone overweight would end up losing about 7.5 stone, compared to about 5 stone with a band patient. The sleeve gastrectomy falls somewhere in the middle. About 60–65% of the excess weight will be lost over 2 years. But with the bypass and the sleeve, most of that weight loss will occur in year 1, whereas with the band it is a much slower, more gradual process. I think it's really important to understand that these figures are not guarantees. They rely on the fact that you make the necessary changes to your diet and lifestyle to adapt to life after the surgery so you get the most out of it. The other point I'd make is that the gastric bypass and the sleeve are very reliable operations. Most people will achieve somewhere near that figure that I've quoted. However, the gastric band is a much more difficult operation to predict the actual amount of weight loss a given patient will have. There's a huge variation in the outcome with band patients, simply because the gastric band is much more dependent on how well the patient uses it than the other operations that I've described.